Pneumonia is very common, something you will see in your exams very, very often. So you need to understand it, okay? Because anytime, most of the time, most often you'll be treating pneumonia in the hospital anyway. So let's get into it. It's not a difficult topic at all right? Okay, so let's crash this. Now look at this picture you see. It shows the two lungs, the trachea. All right, the trachea and then the lungs. I used to get confused about which of the lungs had three lobes and which one has two lobes, But it's very, very easy to know. The left lung is relatively smaller than the right lung because the heart is more towards the left side, so it has occupied more of the space in the mediastinum on the left. Okay, so that's how you can use to remember that the left lung is usually smaller than the right lung. Now, how do you remember that the right lung has more lobes than the left? Because it's bigger. All right, anything which is bigger should have more lobes. Okay, and the lobes are upper lobe, middle lobe, and lower lobe. All you have to do is draw a less than sign. Okay, so you just draw a less than sign in the lung, and that's how you have your middle lobe, a less than sign. And then for the left lobe, it's just one line like that. Okay, so that is it. Okay, so a brief recap of respiratory system anatomy. We are not doing any detailed um, anatomy. Okay, so here is where the air comes from, either your nose or your mouth. Okay, it enters into your nasal cavity or your oral cavity, into your nasopharynx or your oropharynx. So the L pass here, okay, and then it will pass in here and goes into your larynx. Okay, so from the pharynx, nasopharynx, oropharynx into nasopharynx, oropharynx into your larynx, then into your trachea, then from the trachea down, down, down into your bronchus, your bronchioles. All right. Uh-huh. Then at the end of it, it's the alveolus. Okay, so there are many, many alveoli. All right. So once oxygen gets to the very end, which is the air sacs, all right, or the air balloons, I prefer to call them balloons. Okay. Once oxygen gets into the air balloons, they diffuse out, all right, through the interstitial space. So here is the interstitial space. Okay. Into the blood capillary. All right. And if there is carbon dioxide, it goes back inside the alveolus and then it goes backward and it comes out. All right. So that's just a brief recap. All right. So they call the respiratory system the tracheobronchial tree. The inside of the lungs. Okay, because it's just an upside down tree. If you really look at it, it's just an upside down tree. All right. So this would be the trachea, the bronchus, and then the alveolus at the end. Okay. So I said I prefer to use balloons as what the alveoli look like. All right. So indeed, they are air sacs. Okay. So they are like small, small, tiny, tiny balloons in your lungs. So really, your lungs are made up of tiny, tiny balloons. Okay. So the gaseous exchange occurs at the level of the alveoli. So around the balloon is a little space called the interstitium, and then you have your capillary. Okay, so the balloons in the lungs.